Health Watch, sponsored by Renown Health.
Nearly 90,000 Americans are diagnosed with Parkinson's disease every year. Experts say some symptoms may be subtle, so people could be living with the disorder without even knowing it. In tonight's Health Watch, a closer look at warning signs that everyone should know. Behind Alzheimer's, Parkinson's disease is the second most common neurodegenerative disorder in the U.S. It affects the central nervous system, causing people to have difficulty controlling their bodies, and it worsens over time.
We actually lose about 80 to 90% of our cells, these cells, what we call dopaminergic cells, before we even notice the symptoms of this disease.
Dr. Sanjit Grual with Mayo Clinic says one of the earliest signs can be a slight tremor or shakiness, sometimes in your thumb, index finger, or chin.
One thing that's important to know with Parkinson's is often it's asymmetric, which means it starts with symptoms on one side and then can develop to having symptoms on both sides.
In addition, other warning signs include stiffness, difficulty with movement, freezing of gait, where a person has a hard time starting to walk, a face that becomes expressionless. The person can no longer show emotions. Speech may become softer, and writing may start to look smaller. There may also be sleep disorders that develop,
where patients will start acting out their dreams and they'll start to get very, very physical in their dreams.
Dr. Grual says patients may also develop a stooped posture or leaning forward. There may be blood pressure issues, a persistent loss of sense of smell, and dizziness when the person stands up. Constipation may also be a problem.
We can catch it early, we can treat it early.
You know, right now there's no cure for Parkinson's disease, but the doctor says aerobic exercise may slow down the onset of symptoms and improve quality of life. We've seen that with boxing, for example. The National Institutes of Health say there are certain risk factors that make it more likely for a person to develop the disease, including if there's a family history, if you're 60 or older, if you were exposed to environmental factors like certain pesticides, or experienced head trauma. Men are also more likely than women to be diagnosed with Parkinson's. For a closer look, go to the feature section of our website, 2news.com, and click on the Health Watch icon.